Hello and welcome to another episode of our podcast where we bring the conversations which might go unnoticed and we really think should be talked about until it's too late. Today's episode is mostly about what adults and all the family members should know and should get knowledge about. Today we are talking about thoracic aortic aneurysm. Basically, it talks more about your bodily functions and what your heart says. So, today we have our special guest who will be expressing about his journey and, most important, about the conversation that we are having and upholding in today's episode. We welcome you, sir.
Thank you so much, Kushi. I'm Dr. Tarun Grover, and I'm the Senior Director for Vascular and Endovascular Sciences at Medanta, the Medicity Hospital. And I'm very glad that we are discussing this topic because this is something which is very important because as general public is very much aware of heart attacks and other serious condition, this is something which usually gets unnoticed. And the main challenge is that if it is not picked up at the correct time, and the patient, they do not realize that they are suffering from a thoracic abdominal aortic aneurysm, then it can always lead to certain emergencies where the treatment becomes very challenging. But if we detect these conditions at an early age or at early stage, then the treatment is very straightforward.
The aorta is the largest artery in the heart, main highway your heart uses to deliver the blood to the every organ, every tissue, basically every part that is alive in your body. And when the section of the highway silently weakens, that begins to bulge outwards. That is called thoracic aortic aneurysm. Okay, why is it dangerous, sir?
So correctly said, Kushi, that this is the main highway, the thoracic aorta, because as we know, the heart supplies the blood to the complete body.
Yes.
And this is the main blood vessel which comes out of the heart. And through the chest, it goes down in the abdomen and then supplies the whole body. Now this vessel, if it becomes twice its size, अपने normal size से double हो जाए. So then the normal analogy is किसी भी गुब्बारे में या balloon में, if you keep on inflating it, it will eventually rupture.
Yeah.
So that's the main challenge because of the beating heart, the pressure is transmitted into this vessel. And if this vessel is weak, then eventually it can rupture. And that rupture becomes very fatal because you do not have that much of time to bring the patient to the hospital. So the main concern is to detect it early. Now, so many times we see that some young adult has had a heart attack. He was absolutely fit and he used to go to the gym also. He was absolutely leading a healthy lifestyle, but still he had a heart attack. So that's the major problem. A lot of time people, they die of a ruptured aortic aneurysm and they are thought that probably he had a heart attack. So that's the main important thing.
So that's not actually a heart attack.
Yeah, it's not a heart attack, it's a ruptured aneurysm.
Okay.
Yeah.
And what are the symptoms? मतलब कोई chest pain हो रहा है या कुछ?
So initially when it starts developing, it does not give any symptoms majorly.
Okay.
But the main symptom starts happening when the size becomes really large, which means it becomes almost double its size. So then patients can have chest pain, they can have difficulty in breathing, they can have hoarseness of voice also because there is one important nerve which controls our vocal cords that goes close to this vessel. So when this vessel becomes large in size, it starts compressing this nerve and people might start experiencing hoarseness of voice. So a lot of time, if people, they feel that they have developed hoarseness of voice, they have to be screened that probably they could be suffering from a thoracic abdominal aortic aneurysm.
And is it manageable or?
Yes, it's definitely manageable. The good part is now there are so many advancements. You know, if I will compare the treatment of thoracic aortic aneurysm for almost like, if we say for last 30 years on, it used to be always an open operation, which means somebody had to open your chest and then it had to be treated. But now everything has become minimally invasive, which means that you just have special devices which can be passed through your blood vessels without making any incision, and you can like put a new scaffold or a stent in these vessels which will reinforce these vessels, make them strengthen, and then the part which is dilated will get totally excluded. so that there is no blood flowing into that, and then it will not rupture.
And how come you got into this? Like हर किसी को कुछ ना कुछ करना होता है लाइफ में.
So that's different because I'm a vascular surgeon.
Okay.
And fortunate for me that I work in an institute where we call it an heart institute, and we have a team of doctors which all of us deal together with diseases of the heart, diseases of the main blood vessel which come out of the heart. And we have an excellent team with us. So we have cardiac surgeons who deal with the heart problems. We have vascular surgeons like us, we deal with the blood vessels. Then we have some thoracic surgeons also who deal with the other problems in the chest. So as vascular surgeon, it's very I would say challenging to deal with these things, because we know these are life-saving procedures, and if not dealt in time, these conditions can be fatal and lead to a lot of catastrophic emergencies.
सर मेडिकल फैसिलिटीज़ की बात करें तो आई बिलीव इंडिया में अभी भी काफ़ी हम पीछे हैं कंपेयर करें बाकी कंट्रीज से. फैसिलिटीज़ तो दूर की बात है, अवेयरनेस भी अभी उतनी नहीं है.
नहीं, बिल्कुल ठीक कहना है आपका, बिकॉज आई वुड से आई हैव बीन इनटू वैस्कुलर सर्जरी फॉर नाउ ऑलमोस्ट 25 years. And when I started my journey in vascular surgery, there were very few centers, and still there is a lot of gap, because for a country like India, the number of vascular surgeons are hardly 600 to 700 in the whole country, which is very less for a population of 150 crores. And so that is why I would say, among other specialities, as a lot of advancement has taken. But having said that, I would say good centers in India, they have very good facilities available. So most of the apex institutes among the government, if you talk about All India Institute of Medical Sciences, among the private hospitals, something like where I work, the Medanta hospital. So we are providing services which are almost equivalent to any center in the world. The only challenge sometime in India becomes that when these patients are taken as an elective procedure, which means somebody has been detected a disease, he is absolutely stable, then he has the option to select the institution where he wants to go and get it done.
Okay.
The problem happens when there is an emergency, because then it's become difficult, because if he's taken to any place where they do not have the facilities, then number one, you don't get the proper treatment, and number two, it's not the unawareness among the general public, it is a lot of unawareness among a lot of doctors also. They are also not able to detect what the main problem is. So that's the main challenge.
अगर हम अभी भी बात करें तो दिल में थोड़ी सी भी प्रॉब्लम होती है तो पीपल फील लाइक हार्ट अटैक आने वाला है. मतलब हर चीज़ हार्ट अटैक से ही रिलेटेड हो जाती है. काफ़ी चीज़ों के बारे में लोगों को नहीं पता है इस बारे में. ऐसे सिचुएशंस में डू यू फील लाइक कि इंडियन फैमिलीज़ को अवेयर करना बहुत ज़रूरी है?
डेफिनेटली. एंड आप मानोगे नहीं खुशी, ये काम हम लास्ट ऑलमोस्ट 20-25 साल से रेगुलरली कर रहे हैं. एंड लोगों को समझाने के लिए हमने क्या शुरू किया, बिकॉज हार्ट अटैक क्यों होता है? बिकॉज हमारे हार्ट की जो खून की नसें हैं वो ब्लॉक हो जाती हैं. देयर इज़ अ मिसमैच बिटवीन डिमांड एंड सप्लाई, एंड पीपल दे गेट पेन ड्यूरिंग अ स्ट्रेसफुल कंडीशन in the chest, because when there is a stressful condition, the heart requires more blood, and because of the blockages, heart does not receive that blood. So similarly, we used to explain everyone that if you have blockage in your legs, then we call it a leg attack.
Okay.
So basically, when they start walking, they are not able to walk, क्योंकि उनके पैरों में दर्द आ जाता है, because again a mismatch between demand and supply. A lot of people, they suffer from paralysis or stroke. And that happens because there is a blockage in the blood vessel which supply your brain. Okay. So we call it a brain attack. So, just to explain the general public and a lot of doctors, because every leg pain is not sciatica, or it is not because of your spinal cord problem. It could be because of a blockage in your blood vessel.
Because the blood is not supplying.
So every stroke or every paralysis is not because of brain hemorrhage, which means bleeding in the brain. It could be just because of blockages in your carotid arteries, which supplies the brain. So similarly, this is one aspect where you have blockages. And there is another aspect where there is a dilatation. Vessel becomes bigger in size. So the blockages will put less blood, and the larger vessels, if they become big, they will rupture. So all these things, we have to make the general public aware. But end of the day, it's very important to keep good screening. you have to get your body regularly checked
Hmm.
so that these conditions are picked at an early age.
बट टू वेरी ऑनेस्ट इंडियन फैमिलीज में जब तक ज़्यादा दिक्कत ना आ जाए तब तक डॉक्टर के नहीं जाया जाता.
नहीं, बिल्कुल ठीक बोल रहे हो आप. थोड़ा सा चेंज आ रहा है
हम्म.
because now we see people are getting aware, and I'm surprised because initially when I used to see people and I used to ask, do you suffer from diabetes or hypertension, so they used to give me the same answer कि कभी check ही नहीं कराया. But now things have become little different because so many times people they tell us that we get our all general checkup done 6 monthly or at least once in a year they get it done. So that's something which is becoming good.
जनरली हम अज्यूम करते हैं कि हार्ट में दिक्कत है या कुछ दर्द वर्द है तो या तो जिम ज़्यादा कर रहा होगा, कर रही होगी, या टेंशन ले रखी है. बट क्या ऐसे रीजंस हो सकते हैं कि हमें इस तरीके की प्रॉब्लम्स हो रही हैं?
So it is not a single reason. It is-
स्पेसिफिकली आई एम टॉकिंग अबाउट
yeah,
टीए.
yeah. So it is always a multifactorial, and the problem with thoracic abdominal aneurysm is that it does not always happen people who have unhealthy lifestyle. It is more common definitely उन लोगों में जिनका unhealthy lifestyle है, जो smoking कर रहे हैं, जिनकी uncontrolled diabetes या hypertension है, definitely they would have more chance. But the surprising part it is can be seen in very healthy adults also, because it is something which is concerning our genetic makeup, which means the construction of our blood vessel is in such a way that it is weak by default, which means the cementing material जो हमारी खून की नसों में cementing material होता है, जो उसको एक तरह से normal shape देता है, कि they are made in such a way कि they can sustain a high pressure. Because sometimes you say that किसी का blood pressure 160 170 हो गया, so every blood vessel does not start dilating because of high pressure. So people who are having a predisposition, by birth they have a chance that their vessels are weak, they will develop this problem.
तो अगर मुझे मेरे पेरेंट्स को ये है तो वो मुझे होने के चांसेस हैं.
It is not genetic, which means that if the parents they have, the children will also have, but sporadically some people might have some genetic variation.
Okay.
Good part is it is not passed genetically into the progeny. मतलब अगर पेरेंट्स को है तो बच्चों को नहीं होएगा.
Okay.
ऐसा नहीं है. There are certain genetic conditions, like very common there is a condition called Marfan syndrome. In Marfan syndrome the blood vessels are very weak, and they keep on dilating, and it's very common to see thoracic abdominal aneurysm in people who suffer from Marfan syndrome or people who have connective tissue disorder. Connective tissue वो होता है which is the, I would say, the cementing material or the which forms the structure of our blood vessels.
सर वैसे तो पानी सर के ऊपर जाए तभी वी कम टू यू,
Yeah.
बट इन नॉर्मल लाइफ इफ़ वी हैव टू टेक प्रिकॉशंस या हमें खुद को इस चीज़ से बचाए रखना है तो हम क्या डेली लाइफ में चेंज ला सकते हैं?
I would say सिर्फ thoracic abdominal aneurysm के लिए नहीं, for everything. Number one, we were taught in school prevention is better than cure, which means that how to prevent our body from developing any disease. And for vascular health, I would say healthy lifestyle is the most important thing, which means that how we are dealing with our life on a daily basis. हम क्या खा रहे हैं, how much we are letting the stress affect our body, and whether we do some sort of physical exercise in a daily routine or not. Because a lot of time people they say that I have got a very active lifestyle, whole day I'm running around, but that does not translate into a healthy routine.
lifestyle.
Because we need to incorporate some sort of a cardio exercise, some muscle strengthening, muscle training, which would definitely help for longevity, which will take control of our lipid profile in the body, which means that your sugar will be under control, your blood pressure will be under control. So all these things are very important.
So when they say that don't go to gym, don't train your muscles, don't weigh too much, तो हमें उनकी सुननी चाहिए या करना चाहिए?
I think moderation is the key. So in moderation, everything is good. The problem happens is when we overdo certain things. We do see a lot of youngsters who really want to have a super body. They will take all supplements. So I would say that is something which is very harmful. most of the supplements or the companies which make these supplements, they would claim that they do not contain any steroids. But majority of them, they would have anabolic steroids which will
Correct.
help them for muscle building. So I would say in moderation, everything is important. We should follow it, and that goes true for everything. I think that's very important.
And if a person is diagnosed with
Hmm.
the TEA,
Mhm.
what are the first steps that you take?
So most importantly is, because when you diagnose, then it should be electively treated, which means that if it's very small, then you can still put the patient on surveillance, which
Okay.
means regular checkups after frequent intervals to see the progression of the disease, कि वो उतना ही रह रहा है या बढ़ रहा है. But उसमें again एक challenge रहता है, because India में there are patients who travel from far distances.
Yes.
They might not be able to keep a good follow-up. So we have to judge from case to case basis. If we have diagnosed a patient where we feel that follow-up will be a challenge and he has come to a center where the facilities are available, you judge the risk against benefit ratio, which means, because even doing a procedure has some risk. So you have to judge whether whatever we are offering this patient has got more benefit than the risk. Then we should electively treat these patients. We should not keep them on surveillance.
And what does the study say? इंडिया में अभी कितने लोग हैं जिनको ये प्रॉब्लम है?
I would say that if you compare that, the prevalence is, initially it was thought that it's a Western disease, which means a lot of people in Western countries, they suffer from this problem. And India, this is not a very common disease. But I would say if you feel that it would be around 8 to 10 patients per million.
Okay.
Yeah.
But compare करें तो Western lifestyle is better. Because
No, these Western lifestyle is not better in any way, but there are some. I would say one of the obesity and obesity is almost like an epidemic in the Western world.
Correct.
And in India, the other problem is a lot of patients are diabetic. So diabetes is definitely more common in our country as compared to the Western world. But I don't say that, there are certain, ethnically, there are certain races, like, the Japanese, because they follow a particular lifestyle. And to certain extent, some Southeast Asian countries like China and all, because they are very particular about this, what diet they consume. So that gives them some amount of protectiveness from these cardiovascular diseases.
Okay.
Indians, because of the central obesity and diabetes, unhealthy lifestyle, and what we eat, so that makes the main difference.
Okay. Talking about this disease, जैसे हमें कैंसर के बारे में पहले नहीं पता था, या अब कोविड आ गया उसके बारे में हमें पहले नहीं पता था, तो TAA कब डिस्कवर हुआ था बेसिकली?
So I will tell you an interesting thing, that our first Prime Minister, Jawaharlal Nehru, he died of a ruptured thoracic aneurysm.
Okay.
Yeah. So, and so whenever somebody is taught about,
And I'll be honest with
Yeah.
you, मुझे अभी तक ऐसा लगता था कि he died because of heart attack.
so this or that. So he died because I had the, I would say, the opportunity to work under one of the cardiac surgeons who had attended him when he came to the All India Institute of Medical Sciences with the ruptured thoracic aortic aneurysm. And so there are Albert Einstein. He also died of an abdominal aortic aneurysm. So
And still we have no idea.
yeah.
Lot
So
of people.
there are a lot of people who died of abdominal aortic aneurysm. So it has always been there. And initially, जो treatment था, that used to be an open surgery. Open surgery means you have to cut open your chest. If it is in the it's a thoracic aneurysm. If it is an abdominal aneurysm, then you have to open the abdomen. Then the patient stays in the ICU for 8-10 days. It used to be a whole few months of recovery. But पता तो कब से था लोगों को इसके बारे में. But I would say the main जो advancement हुई treatment में, that has happened over last, especially in India, over last, I would say 25 years. Because I remember जो स्टेंट्स आ गए हैं इसको ट्रीट करने के लिए, जिसको हम एक शॉर्ट फॉर्म में TAA बोलते हैं, thoracic aneurysm को रिपेयर करने के लिए with a stent. So the first one was done almost 25 years back in India. And at that time, there were less than 20 cases done in a year in India. आज की डेट में it's almost more than 3,000 cases which are done in India.
And do you have any case where you want to just share and let the audience know how you discovered it and how you managed the patient to recover?
So I would say the most satisfying part in treating these cases is when you save a patient who is almost having an impending rupture or it has already got ruptured. So 2 cases I remember. One was a international patient. He was a Dutch national and he was brought from the airport because fortunately Medanta has an clinic at the airport also.
Okay.
So this patient had come to tour India, and after his tour he was flying back to Holland. And at the airport he collapsed, and it was a contained rupture. Contained rupture का मतलब ये होता है कि it had not totally got ruptured. It ruptured and the bleeding stopped for a while. So it gives them some time period so that you can salvage these patients if they get the proper treatment. And good part was he was aware of this disease. So when he developed this, he himself told those paramedics who were attending him that this could be the challenge because I suddenly collapsed. I had a pain in my chest. So he was immediately brought to our hospital, and immediate stenting was done under local anesthesia. The good part is you don't even have to give general anesthesia to these patients. बेहोश करने की ज़रूरत भी नहीं है, कोई चीरा लगाने की या कट करने की ज़रूरत भी नहीं है. सिर्फ local anesthesia में you can put this device, and within 2 days patient was absolutely fit and he could be flown back. And he still corresponds. Sometimes he shares pictures from Holland of his family playing with his grandchildren now.
Great experience. वैसे सर अगर हम बात करें कि हार्ट सर्जरीज होती हैं, उनके टूल्स अलग होते हैं, उनके मैनेजिंग प्रोसेसेस अलग होते हैं. यहाँ पर किस तरीके की सेटिंग्स हैं, यहाँ पर किस तरीके की टूल्स दैट आर यू आर यूजिंग?
वेरी रेलेवेंट क्वेश्चन बिकॉज इसमें सबसे ज़्यादा ज़रूरी है, सबने सुना होगा कैथ लैब. Cath lab means a live X-ray, a fluoroscopy. Because whatever you are doing is you are putting guide wires or you are putting catheters in the body through the blood vessel. So normal angiogram करते हैं, जैसे angiography करते हैं हार्ट की. So you require a cath lab. So those cath labs, the machines are, I would say, the little less advanced than the machines which are required for these procedures because इसमें आपको बड़ी images चाहिए. And then you need a lot of reconstruction of these images, or we call it a road map, which means कि आपने एक angiogram खींचा and then you need a road map to do the procedure on that. So all these are now we call them hybrid labs or hybrid OTs, which means you can do an open surgery or you can do an angiogram in the same theater.
Sir, जो endovascular surgeries होती हैं, what are the advantages they offer जो Indian patients अगर use करें तो they'll be in benefit?
So endovascular surgery का सबसे बड़ा advantage जो है, we call it precision without any incision.
Okay.
So you are very precise without making any incision. And not making any incision, you are offering all the advantages of a minimal access surgery. No incision means less metabolic changes in the body. You don't need to give general anesthesia. You don't even need to give spinal anesthesia. I rarely have to come across any patient who does not have a bad experience with a spinal anesthesia. Any lady who has undergone a cesarean, जिसको injection पीठ में लगा है, she still will complain because अभी तक दर्द हो रहा है. So that's just something which people can relate. But in endovascular कोई चीरा नहीं है, लोकल एनेस्थीसिया में हो रहा है, अर्ली रिकवरी. सबसे बड़ा एडवांटेज पेशेंट्स के साथ क्या होता है कि जो उन पेशेंट्स को वैस्कुलर इश्यूज़ हैं, उनको बहुत सारी प्रॉब्लम्स होती हैं. हार्ट भी वीक होता है, डायबिटीज़ भी होती है. सो समटाइम्स दे आर नॉट फिट फॉर जनरल एनेस्थीसिया. समटाइम्स दे हैव, बिकॉज स्मोकर्स होते हैं मोस्ट ऑफ देम. तो इफ़ दे आर स्मोकर, उनकी छाती एक chest condition, one of the major reason for vascular problems. And smoking as well as nicotine consumption, gutka. So that is also apart from developing all the oral problems. So these things will. So वो पेशेंट जनरल एनेस्थीसिया के लिए कभी भी फिट नहीं हो पाते बिकॉज जनरल एनेस्थीसिया में क्या होता है, हम किसी को बेहोश करेंगे, दैट इज़ ईजी, बट इवेंचुअली वी हैव टू गेट देम आउट ऑफ द वेंटिलेटर ऑल्सो. बट advantage of endovascular surgery is no anesthesia, general anesthesia is required. Under local anesthesia, all these procedures can be done. and early recovery, early discharge, early, I would say, they can resume to a normal activities.
But there are some people, let's say there are some patients जो start तो करते हैं but end process तक नहीं पहुंचते हैं. They feel like हाँ अब इतनी कहाँ ज़रूरत है, fine.
Yeah,
So what are the consequences?
So follow-up is very important because you have to tell these patients, and the normal psychology of Indian patient क्या है कि they are very scared कि heart attack हो जाएगा. So they once they are told they have a heart attack, so they will take all necessary precaution. Sometimes they try to ignore all other health problems. So we have to be
Correct.
very proactive. So we counsel them and we tell them that surveillance is very important, because what here we are dealing with a thoracic abdominal aortic aneurysm, it's a diseased vessel. So we will treat one part of this vessel which is diseased, and there could be disease developing in other parts also. So if they don't keep a good follow-up, regular check नहीं कराएंगे, so then the point of treating them early or diagnosing them early, they lose the advantage of that.
Okay.
So it's very important to have a regular follow-up.
And what are the protocols that you follow?
So most importantly, there are certain, I would say, standard operating practices world over. Whenever you treat these patients, first you call them after a month, then you call after 6 months, and then yearly follow-up. So yearly follow-up is very important, and a simple echocardiogram or a duplex, जगह जगह आपने देखा होगा color Doppler. So these things can tell us majority of information. We don't need to do a CT scan every time for a surveillance.
Correct.
But in case we pick up any problem on these non-invasive tests, though CT scan is also a non-invasive, but it gives exposure to radiation. So in case we feel that there is something further which needs attention, then we do a CT scan for these patients.
But sir, कभी-कभी ऐसा होता है, people feel like they can't afford, it's
Yeah.
too costly.
The good part is now there are a lot of health schemes where these procedures are covered, number one. Number two, the number of people in India getting insured has really increased because of the new Ayushman Bharat and other policies. And there are multiple government institutes which are also offering this treatment almost free of cost. So I would say, if the patient really wants कि मेरे को treatment कराना है and cost is a constraint, I would say even in private hospital like ours, we also guide them to those institutions where they can get this treatment done free of cost. Because, and we also do have certain CSR activities where we genuinely feel that patient cannot afford. The industry also helps us. All the industry which makes these devices, they also help us. Sometimes they also subsidize, or even they offer free delivery of these devices also. Because this is something, because if it's not treated, it will be not the favorable outcome for the patient.
Sir, if we compare the numbers, previous numbers अगर हम compare करें, let's talk about Indian patients only, and the people who are maybe aware or not aware, कितना नंबर में आपको इंक्रीज लगता है?
Exponential है, मतलब I would say almost every year I would say the number is increasing 3 to 4 times every year, because ऐसा नहीं है कि ये disease पहले exist नहीं करती थी. We were missing it, and moreover there were very less centers which were offering treatment for this. Now I would say majority of tier 2, tier 3 cities also, there are skilled operators who are doing these procedures. So that's the advantage which is being passed on to the citizens of our country. And otherwise numbers though I think in near future will increase further.
And beside being a vascular and endovascular surgeon, as just a person or as a human, what advice you want to give to the Indian audience who is watching right now to protect and safeguard themselves with a disease like this?
Most importantly, I would say that take care of your health. That is something which is very important, because as a doctor sometimes we also tend to neglect our health. But एक दिन अगर simple सिर दर्द भी हो रहा होता है, it spoils your whole day.
Yeah,
and then you
correct.
can realize that a simple headache can also, and just imagine if we don't take care of our health, and because that's something which is, we have to invest in it, because if we have a good health, that would really be the best asset we have. So don't neglect your own symptoms, because we have heard so many times, and as a doctor we know body will always tell you that something is going wrong.
Correct.
And we should never neglect it and never ignore it, and share it with your doctor, whoever is your family physician, or you don't need to go to a specialist for everything. So you can share it with your general practitioner or your family doctor. The good part in India, everybody has a family doctor, or there is a
Yes.
doctor in the family. So he would definitely guide you that these are the if these are the symptoms, ये आपको परेशानी हो रही है तो ये आपको चेक कराना चाहिए, and then take that seriously.
Okay.
So that's something important.
Well, thank you so much, Dr. Tarun. It was really an insightful conversation, and I believe काफ़ी लोगों को help मिलने वाली है इस podcast से, because there are some things that we really need to know,
Yeah.
and so that we can recover and we can get better.
Yeah.
And there is this saying that prevention is always better than cure.
Yeah.
कि अगर आप खुद को पहले से ही बचाए रखोगे तो there will be nothing better in the world that you could save from. This is it for today, and keep watching The Story Makers. This is your host Khushi Awasthi. Thank you for watching. Thank you.
Thank you so much, Khushi. Thank you for having me over. And in the end, again, I'll emphasize and tell all the audience and whoever is listening that take care of your health. That's something which is the most important thing in our life. Thank you.